Did you know that the right medication can make all the difference in managing your rheumatoid arthritis? But with so many options out there, how do you know what works best for you and what side effects you should watch out for? Hi, this is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc. Today, we are going to break down the different types of medication used to treat rheumatoid arthritis. I'll try to explain how they work, what you expect, and the possible side effects you should be aware of those medications. Let's dive in. As many of you know, rheumatoid arthritis is a complex condition and managing it often requires a combination of treatments. Let's take a look at the three main categories of rheumatoid arthritis medication: the conventional synthetic DMARD or DMARD, biologics, and small molecule. We'll also briefly talk about some other options on symptom management for rheumatoid arthritis. Let's start with the first class of medication, also referred to as conventional synthetic DMARD or disease-modifying anti-rheumatic drugs. These medications have been the backbone of RA treatment for many decades. They are designed to modify the course of the disease by slowing down the immune system's attack on your joints. Now, you might be wondering, how do they work in rheumatoid arthritis? DMARDs help to reduce inflammation and suppress your immune system that is hyperactive to prevent further joint damage. By doing so, they can stop the disease from progressing and protect your joints from joint damage. Some of the most commonly prescribed DMARDs include methotrexate, sulfasalazine, leflunomide, and hydroxychloroquine. When starting DMARDs, expect a gradual benefit over weeks to months, which will require some patience from you. But these medications could also come up with some side effects that we have to be aware of. Common side effects include nausea, liver-related issues, lower blood count, and diarrhea with methotrexate and leflunomide. It will require regular blood testing to look for those side effects. Plaquenil is also known to cause some side effect, which is rare but could affect your eyes and require regular eye monitoring. The next class of medication are biologics. Now let's talk about what are biologics. These are newer and more advanced class of drugs that target specific parts of your immune system to reduce inflammation and prevent joint damage. You might wonder, how do biologics work? Biologics target specific protein involved in inflammation process, such as tumor necrosis factor or TNF, interleukin 6, and many others. These proteins are responsible for driving the inflammation and damage to your joints. By blocking these proteins, biologics help control the inflammatory process in rheumatoid arthritis. Some of the common examples of biologics include adalimumab, etanercept, and Actemra or tocilizumab. And there are a lot of other biologics. These drugs typically are prescribed when conventional DMARD are not enough to control your symptoms and your disease progression. They are typically used in injections or infusion form. Now, we have to be cautious about this drug to watch out for several potential side effects. These include increased risk of infection due to the immune system suppression, as well as possible injection site reactions such as redness or swelling in the area of injection, and much more. There are rare side effects but serious ones such as TB reactivation, which require screening even before going on those medications. While biologics are highly effective, they come with higher cost and the need for regular monitoring to detect any adverse side effect, particularly the infection risk. The third category of medication, we call them small molecules, also called targeted synthetic DMARDs. Let's now discuss about these. The third and the newest class of drug are also called small molecules or targeted synthetic DMARDs. These are relatively newer class of medication that work differently from biologics but are as effective in controlling joint inflammation. Now let's dive into on how they work. Small molecule blocks specific pathways in immune system such as Janus kinase pathway, also called JAK pathway, which are responsible for triggering inflammation. By blocking these pathways, small molecules reduce the inflammatory process that is responsible for causing inflammation in rheumatoid arthritis. Examples of small molecules include tofacitinib, baricitinib, and upadacitinib. The great thing about this medication is that they are taken as pills, which is often more convenient than taking infusion or injection medication. And the good news is they also work much faster than conventional DMARD, and often providing relief much faster than those conventional biologics. Small molecules are a great option if biologics are not effective or if you prefer oral medications, but they do come with some potential side effects that we need to watch out. These includes increased risk of infections, increased risk of blood clots, and higher risk of potential liver problem. We do need to monitor for those problems. Now, let's talk about a different class of medications which can help manage your rheumatoid arthritis symptoms. This medication can be used to manage your RA symptoms when you are having a flare or when you are just starting these biologics. Since most of the biologics and DMARD work slowly, you need some help to manage your symptoms till those medication kicks in. The first commonly used medication includes non-steroidal anti-inflammatory or NSAIDs, which relieve your pain and inflammation much quicker. But they do have some side effects too. Some of the common side effects we need to watch out includes any type of gastritis and rarely kidney or liver problems. So we need to monitor for those problems. Now, you might be wondering how NSAIDs work. They usually typically block molecules like COX-1 and COX-2, which are the enzymes responsible for producing inflammation. These medications block the inflammation pathway, improving your symptoms of rheumatoid arthritis. Some of the common examples of NSAIDs include ibuprofen, naproxen, and prescription options like diclofenac and Celebrex. These medications work quickly to reduce pain and swelling, making them useful for managing flare-ups. Now, with this medication, we have to be cautious of some side effects. Long-term use of NSAIDs can lead to several side effects, including stomach ulcers, gastrointestinal bleeding, and even kidney damage. There is also some risk of increased heart attack and stroke if taken for a long period of time. Therefore, they should be used with caution as they primarily manage your symptoms rather than treating the root cause of rheumatoid arthritis. The next class of medication that can help manage your symptoms include corticosteroids, or steroids in short. They are potent anti-inflammatory medication used to manage severe symptoms or flare-up of rheumatoid arthritis. Steroids like prednisone mimic natural hormones that reduce inflammation and suppress the immune system. They work quickly but often provide relief within days, which is why they are often used during flare-ups. Corticosteroids are effective for short-term relief but can cause side effects like insomnia or poor sleep, mood changes, and weight gain. However, prolonged use carries significant risks including osteoporosis, which is weak bone, high blood pressure, and increased risk of infection. Due to these concerns, they are typically prescribed for limited period, often as a bridging therapy until other medication takes the effects. Managing rheumatoid arthritis is a long-term commitment, but the right treatment plan can make a huge difference in your quality of life. It's important to work closely with your healthcare provider and your rheumatologist to find what works best for you. I'm excited to announce the launch of my upcoming book, The Holistic Rheumatoid Arthritis Guide. In this book, I go beyond just medications. You will find holistic strategies that include lifestyle changes, nutritional tips, mental health practices, and more. Everything you need to empower yourself in your RA journey. Rheumatoid arthritis may have attacked you, but do not let it defeat you. This book is designed to help you take control, find relief, and thrive with rheumatoid arthritis. If you found this video helpful, be sure to like, subscribe, and share it with someone who might benefit from this video. Thank you so much for watching. This is Dr. Ananta, your rheumatoid arthritis coach. I'll see you next time. Bye-bye.